For those of us with parents and grandparents in nursing homes and assisted living facilities, the record spike in those testing positive for the novel coronavirus is very concerning, and we worry about the increased risks for our family. A new survey conducted by the American Healthcare Association and National Center for Assisted Living shows a disturbing trend in the amount of time it's taking labs to process COVID-19 tests of the staffs at those facilities. Nationwide, 56% of nursing homes and assisted living communities said lab processing was the top barrier for access to testing. Nearly 9 in 10, 87%, said obtaining test results back from the lab companies is taking 2 days or longer. 63%, 2 to 4 days. 24%, 5 days or more. Problem is, the virus can spread like wildfire in that time. In Florida, the news is much more encouraging. Kristen Knapp with the Florida Healthcare Association joins me here on the morning show. So we chatted the other day and you told me the turnaround time here is much quicker. How quickly are the test results being delivered here?
That's right. Well, here in Florida, actually, our state has invested in our long-term care centers. They've contracted with a private lab that is conducting testing of our long-term care employees every 2 weeks. And those lab results are expected to be about a 48-hour turnaround. So we're very encouraged by that because, like you said, you can be positive with COVID and show no symptoms. And that testing really is important because it does give us important information for making clinical decisions about our residents and staffing decisions. So we are encouraged. This is an initiative that's just getting underway. We did a statewide testing of all our long-term care employees that wrapped up throughout the month of June. And now we're on a every 2-week testing initiative that's getting started right now.
So why is the rest of the country having a problem, and why are things better here in Florida?
Well, I think initially when we started really seeing this virus progress early in March, we did have our own challenges here in Florida because there just was just a shortage of testing supplies, testing kits, labs that even could conduct the tests early on. But our state officials have been very proactive here. I mean, we've had a lot of executive orders, a lot of initiatives, and our long-term caregivers have been very proactive in their infection protocols. So, I think everyone here in our state has been committed to the elderly because we know our population is so vulnerable to this virus. So we have, we've been doing testing, as I said, for quite some time. I think in some states, you may just see that the virus is now starting to progress, more so than what we saw early on here in March.
And we all want to be assured that, our loved ones are being protected. So how often is this testing done?
So right now there is an initiative to test employees every 2 weeks. It's something that the state is actually providing. They're providing those through a contracted lab. Those test kits are being shipped to the long-term care facilities, and they will test every 2 weeks. If an employee doesn't test after July 10th, then they're not able to enter the building. So it's really a means to try to make sure we keep our residents safe, make sure our staff are protected. As the state opens up and people are moving around, our employees still need to be able to take care of their families, go to the grocery store, put gas in their cars. So they're coming in and out of the building. So that testing, along with the screening protocols that we're doing, taking their temperatures, making sure if they don't feel well, that they do stay home. That testing is just going to be another elevated level of protection.
And actually, Florida found a way to mitigate the spread in senior communities by dedicating facilities for coronavirus patients. And there's one right here in Jacksonville.
That's right. Actually, that was the first one that opened up, Dolphin Point. That company, Clear Choice, is one of our FHA members. They stepped up. Now we have 12 COVID isolation centers across the state in regional locations. It really gives an opportunity to make sure, you're right, it does help mitigate the spread. If you have residents who have COVID, you can transfer them to the COVID isolation center where they can be cared for with designated staff. Wearing the appropriate PPE. Again, we know that this virus can spread rapidly, and we know that people could have the virus and not show any symptoms. So, these facilities are a way, if someone's transferred out of a hospital and they do have COVID and they need to recover, or if you have someone in your building who has COVID and needs to be transferred out, it's a way to alleviate hospital bed overcapacity by placing them into these care centers across the state.
Yeah, my dad's 89 and he lives in a senior facility, and I know he and his friends are scared. So what do you say to them to allay their fears?
You know, it is scary for all of us because we don't have a vaccine yet, and this virus seems to be changing. And, you know, you can be asymptomatic and still have COVID. But, you know, our caregivers have been heroic throughout this pandemic. I mean, they are wearing masks every day in the building. They are doing, you know, all different types of infection control protocols, taking all types of precautions, and also doing things to make sure that they're helping to meet their residents' quality of life needs. You know, we're not able to, you know, our residents can't see their families because visitation is restricted. They can't eat in group settings. They can't have their group activities. And that's challenging for an elderly person who, you know, this is their home. So our caregivers have really stepped up, try to be creative with window visits for families, Skype, Zoom. You know, this technology has allowed us to connect. They're doing all types of group activities through, you know, bingo, through over the intercom system, you know, and they're being very vigilant. And, you know, people that care for the elderly, they're special people. They have a heart and a passion for it. And, you know, we're all in this together, and we're working hard and remaining vigilant. And I would just say, you know, just if you have questions as a family member, call your facility. I mean, we're here and we want to continue keeping your loved ones safe for, you know, as long as we need to.
Yeah, my dad told me the other day, hey, I got to get off the phone. I got to go do teleconferencing trivia. And I was like, you learned how to do that?
Great.
He said, yeah. Hey, Kristen, thanks very much. Have a great day.
Thanks for having me.
We'll be right back.